Well, folks who use some of the most widely prescribed narcotic painkillers might soon have a harder time getting those medications. The feds are enacting some new rules this fall to restrict hydrocodone painkillers like Vicodin. Those drugs can become highly addictive. Fox News Medical 18er Dr. David Samadi is chair of urology at Lenox Hill Hospital, professor of urology at Hofstra North Shore LIJ School of Medicine. I suppose you have patients who need this stuff, right?
So we obviously write for these prescriptions after the surgery when the patient have pain. When I was in general surgery, we used to write a lot for these medications. And unfortunately, I think we as doctors, we're the cause of this problem. We write these prescriptions, high number of these pills, very addictive. And now DEA just announced that in 45 days, Vicodin is going to join OxyContin and fentanyl. It's going to be Schedule II kind of medications. That means there's going to be a lot of restrictions, and pharmacies are going to regulate this. So if you need to get more of these medications, you have to go back to your doctor to get this. This is actually very good news for both doctors and patients, John, because obviously these are very addictive. We have 7 million Americans that are abusing this kind of controlled substance. We are writing about 259 million of these prescriptions, which is too excessive, too addictive. And one of the reasons why DEA is jumping on this is because we have 16,000 deaths. This is the highest number that we've ever seen, more so number of deaths from this than cocaine and also from heroin and motor vehicle accidents. So this is time to change it.
Up till now, as I understand it, it's possible for a doctor to write 6 months worth of prescriptions at once. I mean, that's one of the things they're going to restrict.
And that's true. And also a lot of doctors are going to write for 30 pills, 45 pills. Patients don't know how to really get rid of these medications once they're done with it. And a lot of them get hooked up on these medications and it stays with them after a minor procedure. So we want to make sure that we cut down on the numbers.
Some of them blend in a little aspirin or acetaminophen with the product, and I guess in some circles the thinking was, oh, that makes it less addictive, but that's not necessarily the case.
It's not the case. So you're talking about Tylenol number 3. So it has Tylenol, but it also has codeine in it, and these are all addictives. What happened is now these medications are going to go from Schedule 3 to Schedule 2, meaning that it's medical for medical use, but high addictive behavior. And this is actually great for both doctors and patients. And I'm glad that in about 45 days, we're going to see more restrictions on these medications, mostly Vicodin.
Assuming the doctors follow the restrictions, because, you know, there are some
the government is looking into it and the pharmacies are looking into it. So they're going to refuse filling in all these prescriptions, big numbers, big amount. Good news.
Good news. All right. Dr. David Samadi.
Good to see you, John.
Thank you.